Well, debate on healthcare reform has been brewing in every corner of the country. This is great because it is a shame that in the wealthiest nation in the world, we have 120 million uninsured and underinsured. And expect that number to get even worse given the economic downturn. We need real healthcare, not health insurance. Healthcare reform. Everyone, regardless of ability to pay, regardless of gender, sexuality, race, residency status, regardless of a pre-existing condition, should be granted access to health care. When we talk about HIV and AIDS, we should not overlook the grave importance of providing every single person in the United States the medical attention that they need without discrimination. In a healthcare system that is brimming with insurance companies, medical providers, and drug corporations blatantly seeking billions in profits, so many people diagnosed with HIV and AIDS struggle to get sufficient care, even though they are clearly in dire need of it. Too many are denied insurance coverage, and since the HIV/AIDS affected population has become disproportionately poor, too many are unable to afford it. Only 17% of people with HIV have private insurance coverage. Meanwhile, public health programs on which more people with the virus rely place a lot of restrictions on who they allow into a program, when it starts coverage, and how much care one will receive. Medicaid, for instance, denies payments for HIV treatment services for people who are not parents, minors, elderly, which most HIV patients are not. The only way that they can qualify for coverage is if they have full-blown AIDS. The scenario is grimmer for HIV-positive women and people of color. They are, of course, disproportionately afflicted with poverty, and they receive even less and lower quality health care. How gruesome is this when a whopping 70% of the population diagnosed with AIDS are people of color? And now budget cuts on social services designed to assist the most disadvantaged are being imposed at both federal and state levels. Here in Washington, the legislature and Governor Gregoire, who once proclaimed providing access to health care to all Washingtonians as one of her goals, have decided to cut the funding for the Basic Health Program. Yeah. Basic Health is a state-subsidized health plan, far from perfect, but about the only health care plan that the poorest of the poor can afford. It does not screen out people with HIV/AIDS, although there is quite a long exclusionary period. This decision to cut the budget for this program was made backstage without democratic public input. The Healthcare Authority will raise enrollees' premiums up to double their current rates and kick 40,000 Washingtonians, the poorest of the poor, out of the program. Just how many poor people with HIV and AIDS who need health care so desperately will get excluded from the program because of this budget cut? Well, I don't know the answer to that, but I can tell our public officials don't give a hoot. Sisters Organized for Survival is raising hell about this. While we call for 100% nationalized medical industry completely free of health profiteering, we also deem it crucial to fight for the preservation and expansion of social programs like Basic Health right now. We want to hold our elected officials accountable for yet another huge assault on the working poor. We want to push them to raise taxes on the rich and make them pay their share instead of putting more burden on the poor people. I invite you to participate to save and expand Basic Health by signing and collecting signatures for the petition and helping organize a tribunal that will be held on November 14th at the Rainier Community Center. Please also come to our organizing meetings every Thursday at 7 p.m. at New Freeway Hall in Columbia City. Well, thank you so much, friends, and if I may add, as a working class woman of color, I am infuriated by the right wing perpetuating racism, nationalism, sexism, and homophobia. And tomorrow I will see you all at Volunteer Park at 2 p.m. as we stand up against the right wing and march in the name of equality.